Hi, this video is about T and D at the beginning of words. This is a list of the languages that may have a problem pronouncing T and D. The check marks are languages where the problem is most likely at the end of the word. Now, I can't tell you exactly why you are having a problem pronouncing T and D. I do know that usually, if you are pronouncing T at the beginning of a word, your listener may be hearing D. And usually, this is the result of not enough air coming out. This is called aspiration. If you're interested in knowing more about aspiration, you can look online. I'm sure you can find a lot of information under aspiration of stops. Now, teachers will usually give you some ideas for testing yourself to see if enough air is coming out when you pronounce T or even P at the beginning of a word. They might ask you to put your hand, and you have to put your hand under your mouth because the air is going to come down rather than straight out, and pronounce test, test, test. See if you can feel air on your hand. Or they might suggest that you use a piece of paper and hold it close below your mouth and say time, 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 time. And you can see the paper move a little bit. Okay, T and D are a minimal pair. And that means that they are produced in the same way, in the same position in the mouth. The only difference is T is voiceless, meaning the sound is only air. And D also has air, but it adds voice or additional sound from the larynx, and it's called voiced. Now, T and D belong to a group of sounds called stops. There are 7. So in this list, the P, the T, and the K are voiceless, and the B, the D, and the G are voiced. Now, there is a 7th stop, and it is not part of a minimal pair, and it's a glottal stop, and it's produced far back in the throat. So P and T are usually the 2 stops that will give you the most trouble, especially at the beginning of words. K is not so problematic because as you go back in the mouth pronouncing, the air has to come out farther. So you're going to get the most air coming out with a P, then a T, and finally a K. Okay, let's look at the anatomy. Okay, stops do just what they say. They stop air and then they release air. So in the case of T and D, the air comes up from the lungs and it is stopped here. Now you see this area behind the tooth. This is a special area called the alveolar ridge. It's really important area for many sounds in English. So the alveolar ridge is not just a little bump there. It's behind your teeth. So if your teeth are like this, the alveolar ridge goes around behind your teeth. And in a T and D, the tongue comes up, touches the alveolar ridge, and stops air. Then the air is released. I'd like to show you one more way that you can feel what this air is like when it comes out. Think about, sometimes I need to clean my glasses, okay? And I will take my glasses and I will go to clean my glasses. This is the type of air moving out that you need to have when you are aspirating T and P. Now, it's very short. I can hold this a long time. But because these are stops, this has to be really short. I think you can hear the air at the end. It's very short, but it requires some pushing, some force to get enough air coming out. Okay, I hope that was helpful in understanding T and D. Thanks for watching my video. Hope to see you again.